Welcome to today's Meet the Funders session, where you'll learn more about the Home from Hospital Fund, currently available in the Rochdale Borough. The session will be delivered currently by Maddie Hubbard, Rochdale Director. Over to you, Maddie.
Thanks, Laura, and thanks everyone for joining us today. So we're really excited about this fund. Where this came from is the Better Care Fund has a really large pot of money that's managed by social care, and they have recognised that they've got really big challenges, particularly over winter, around hospital discharge, both around people going into hospital that didn't necessarily need to go in, and about people coming out of hospital and maybe lacking confidence or connections or support they need to stay out of hospital. And what's great is they've really recognised that actually the voluntary sector is so well placed to have those relationships in our communities and have the skills to be able to support with this. And instead of social care just saying, right, we want X, Y, and Z service, deliver it. Apologies about noise in the background, if you can hear that. They're saying, right, here's the challenge that we're facing, but like opening it up to the voluntary sector to say, where do you see the solutions and how can we work together on this? So it feels like a really exciting opportunity to work together and to really demonstrate what we can do and the difference we can make in communities. So there are two strands of this fund. The first one is about culturally appropriate support for people leaving hospital. And where this came from is there's a Greater Manchester VCSE Hospital Discharge Alliance that did some mapping across all of the boroughs across Greater Manchester to say what support is there in the voluntary sector for people who are leaving hospital. And the kind of support someone might need when they're leaving hospital is support to boost their confidence, to not be isolated. So just someone to check in with them. It might be someone to make sure their home is safe, practical support like delivering prescriptions or food, or just help to kind of, feel well, kind of check in with them and make sure they're okay. And what the mapping found is that there's some really great support in Rochdale, but there's a gap around specific services that are culturally appropriate, so that might meet the needs of different religious or cultural or ethnic communities when they're leaving hospital. And so what we're doing is we're trying out seeing what could happen if we put out grants around that. So there's two levels of grants. One is up to £5,000, and this is for people that maybe haven't done anything like this before, but have those really good relationships with people that might be coming out of hospital. So maybe they've already got a social group for older people, or they support people who are more at risk of going into hospital. And it's to give them opportunity to try out doing something different and seeing if this is an area of work that actually would really benefit other things you're doing. And then there's grants of up to 15,000 for people that are maybe already doing some work in this area and want to strengthen it. Maybe you've already done some work with the public sector in some way. Maybe you work with social care already, or maybe you do a bit of work with the NHS already, and you're going to kind of build on that and have a chance to kind of strengthen those relationships and get more referrals in. But again, we recognise that, there's not anything that directly already existing. So it's really about, let's try out some different stuff and see what we can build. And so that's the culturally appropriate support. And then the other fund is around prevention and wellbeing support. So this is to stop people needing to go into hospital in the first place. So it's about addressing kind of social determinants that keep people out of hospital, whether that's social connections and confidence, whether it's physical conditioning, improving wellbeing, connecting with people that receive home care or live in care homes. And again, the focus is really on people that are more at risk of going into hospital, because obviously prevention and wellbeing is such a broad topic, but it's really trying to really specifically focus on the cohorts of people in our communities that are most likely to need to go into hospital. So people living in care homes, carers for older people, disabled people, older people receiving care at home, for example. But with both of the funds, we're really open to the fact that that's not a definitive list of people that are more likely to need to go into hospital. And we're really happy to listen to you and your experience. If you can tell us, we work with this cohort of people, and actually we know that they're also more at risk over winter of going to hospital or coming out and being isolated, then absolutely there's flexibility in those kind of groups that we're talking about. And so again, the prevention and wellbeing support is about working with the social care team, potentially building up those relationships, but also just strengthening people in our community. One sec, I have a feeling that Hayley might have gone onto a Teams link.
I'll join and let her know.
Thank you. That would be great. Thanks, Laura. So for that grant, the grants available are, let me find them. Yes, apologies. The prevention and wellbeing, it's up to 10,000 or up to 25,000 for that one. And the deadline for both of those is Tuesday, the 17th of October. So we've still got a number of weeks. Let's see, that's 1, 2, 3.5 weeks away. So still a kind of good amount of time to develop a bid. What we'd really encourage you to do, because we know, this is the first time as Action Together we've done kind of grants up to 25,000. It's the largest grants we've ever put out. And we also know it's quite specific, particularly around the culturally appropriate support. It might be a kind of new avenue for your organisation. So we'd really encourage you to get in touch with us. Our development workers can sit with you, talk through your project idea, have a look at your grant application, whatever it is that we can do to help you, because we want to make sure we've got really strong bids coming in, because the more of an evidence base we can build of the difference we make here, we've got a really strong case for actually having this investment again in future years through the Better Care Fund, and there's potential to get a lot more money into the sector. This time it's £230,000 going into the voluntary sector, and so the potential for that to happen again next year, potentially the year after, if we can really prove the difference that we can make, that we know that we can make, the better. So I think that's another thing to think about, is how are you going to demonstrate the difference you're making and the impact through your project. So I would love to open up first to questions. Has anyone had a read of either of the funds or the application form or the priorities, and got any questions that you'd like to ask? So Calder, go ahead. I think
you're on mute.
You're on mute, Calder.
Sorry. Right. Our project's been going on for 39 years. And what we also do is we do prevention work as well as culture appropriate. So, you've said there's 2 strengths. Can we target both of them, or do we need to do one?
Yeah, so it'd actually be helpful once Hayley gets it to answer. But from my perspective, I think as long as it's a strong application for both, it's not that you have to apply for one or the other. And equally for the prevention and wellbeing, having a culturally appropriate angle to that would be really welcomed. It's not that it's only the culturally appropriate fund that we want to hear about culturally appropriate projects. So yeah, if you can, have a kind of strong application for both, then that's absolutely fine.
Thank you.
Mark.
When you spoke about the level of income, or not income, but grant available, does that mean there are multiple pots, or is it just one of this and one of this?
No, so there's multiple under each. So let me find the numbers. I think for the large grants, there are, you have to bear with me, I don't have it in front of me. Yeah, there's the pot for prevention and wellbeing is 80k, and the pot for culture appropriate support is also 80k. So there's multiple grants under each of the things. And I think what we've said is we're going to be a bit flexible about it. We're not saying there's 3 25k and 1 10k and so on, because it is about the quality of the grants that come through and how it works together, I'd say, as different projects as well. But yeah, no, there's going to be multiple. Overall, it's a large pot. Hayley, welcome. Would you like to introduce?
Hi, everybody. I am so sorry. Technical problems, and our system doesn't like Zoom, so it's taking me a little while to get in. So apologies, but I'm here now. Hi, good afternoon, everybody. So I'm Hayley Ashall, and I am the Assistant Director for Adult Social Care Commissioning and Prevention here at the local authority. And so I'm sure Maddie's been telling you about some funding that we have, and I'm really excited about it, because it's nice to be able to do something jointly and put our heads together. So I don't know how much Maddie has talked about it, but
can I tell you what I've said already? And
then
please pick up from there. So I've said that the money comes from the Better Care Fund, and I've
that's right,
through just an overall description of the 2 different funds. and the kind of level of grants and the deadline. But I think what would be really helpful actually is your perspective on what you're excited to see and, you know, where it's
brilliant.
to.
Well, I'm excited to see community action. That's what I would say. That's what I'm excited about. So I've only been in Rochdale probably since, I'd say, early November last year. And before that, I was in Bury and then Oldham prior to that. But all my roles have been centred around adult social care, but always had involvement with the fantastic voluntary community faith and social enterprise sector in some way, shape or form. And I am one of those real firm believers that actually when we work together, we get better outcomes. And actually, I'm going to be honest and say our voluntary community sector do things probably better than some of our statutory services, but that's just my opinion. I definitely think there's things that we can do. So when I got the opportunity to lead on the Better Care Fund, it was an opportunity to look at things differently. And the Better Care Fund does focus, the part of the money I've taken this from, around discharge from hospital. So getting people home from hospital as safely, efficiently and effectively as possible, but also something around admission avoidance. So preventing people from going into hospital in the first place. And that's when I reached out to Maddie and said, can we do something? Can we set up a process to enable our community sector to tap into some grants to do some of this work? And I don't want to prescribe what that looks like and how that would function, because I want you guys on the call to come up with some of those ideas and tell us, if you like, what you think would work. As I've mentioned, we do have to have a focus, if we can, around helping people get home from hospital. I'm not talking about physically get home, though. I'm talking more around what could be at home in the community setting and sector to be able to support them. So the key things for me is around being able to stay well and connected, to have hobbies, interests, to have things on locally that they can really feel that they can have an identity with and reach out to and gain support from. And in the same way, I think working in that vein to provide some support that means that people don't need us in the first place in terms of our wider health and social care system, and possibly preventing some admissions where possible, or readmission. So when somebody has come out of hospital, if there's anything we can do to stop them going back into hospital. Now, I don't want you to get worried and think, goodness me, we're not clinical experts, we're not therapeutic interventions. I'm not asking that of you. I'm a firm believer that when you look at the impacts on somebody's health and well-being, even being lonely and isolated chronically is the same as smoking, you know, quite a considerable amount of cigarettes each day. When you look at people who go to our primary care colleagues, so our GPs, people turning up in hospitals and A&E, quite often it's not because they have a clinical or a medical need, it's because they have a social need, because there's something out there that isn't there for them. And I think that's when we can really work with yourselves to do something different. So I don't know if that's enough, Maddie, to kind of give my kind of excitement and thought on this process.
My only other thought would be, if someone's organisation does great work kind of in the community, but actually doesn't have any experience of working with, in partnership maybe with the NHS or with social care, what kind of thing can your team offer to help them kind of connect into that world if they want to find the right people to support?
Absolutely. So in terms of the people to support, we have system flow meetings 2 or 3 times a week, and we're looking at people that are being discharged from hospital all the time. So I have that information readily available within the system. We have discharge hubs, and what the discharge hub does, if you like, is a team of people from social care, healthcare and other areas who come together to look at who is being discharged. So if you need an actual foot in the door with those types of services, absolutely me and the team can look at how that would work. And I think, no, thank you. And I would think actually that being part of that service offer, if you like, part of that discharge hub is probably where the benefit of some of this could come. In terms of what else we could link in is that we have a world of social care officers out there who I think would love to know what is going out there in our communities now and existing. So we could help maybe create some of those bridges, if you like, and connections, but also with anything new that launches from this, absolutely we can connect it in. And if we need to, if there's somebody that's got some ideas that you want to talk it through before submitting a grant, absolutely we can connect you into either some of my commissioning team or the social workers to have those kind of conversations. So I guess what I'm saying is, yes, there's information available directly around, you know, patients that are being discharged, the types of people that are being discharged, and we can connect you into that. But this is, you know, nothing is off the table here. I don't think any idea shouldn't be explored. This pot of money is about trialing things and seeing what works and not being afraid to make mistakes. And if something doesn't work, we say, do you know what? We've tried that and that's okay. Why didn't it work? And can we try something else? So yeah, there is support there, Maddie, that we can connect in around information and connections themselves for definite.
Thank you so much. So let's open up to anyone else that might have questions now that Hayley's here. Any more thoughts? And if you've got questions about your specific project idea, also we can create opportunities afterwards. But yeah, Paul, have you?
Oh, I was just about to put my hand up then, but you jumped in. I think it's difficult sometimes to connect people together. So I think I'd like to take that opportunity, if possible, that Hayley's offered to maybe connect up either in a meeting next week. We've got a meeting next week. I know Nicola's on a call, and we just to give you an overview of what our ideas are. So if possible, you could share your email address, and then we can. I mean, somebody from your team can come along because I've already reached out to Mark, who's on the call, because what I'm looking at is kind of we can't deal with this all on our own. So working in partnership with other organisations and kind of like strengthening our bid, which is around it's around residential and care homes, because we feel as though there's a massive gap there after COVID. We feel as though we can offer support to around training and around going into the home as well, and also around some online videos that we can do. The reason it came into my mind was because as part of the emergency support hub that was set up during COVID, I realised that there was a need within residential care to have something better than that was. So it's almost like building the kind of resilience to any further strains, if you know what I mean, of anything like that. So it is physical, but we can also offer that socialization stuff. So there is connections to other organizations like HMR Circle, where they do lunches, we can do social dances, we can do that. So it's wrapping all that round into an offer, and maybe having a chat next week. We've got a meeting.
Like the sound of that.
So I mean, we've already like looked at options around the digital support, around getting pathways through into other organizations, so it's more of a social prescribing element to it. So does that sound like
I think, if I can, Maddie, that sounds quite exciting. And actually, probably a lot of you would already know this. I have a lot of information back from our providers. And of course, when I'm saying getting people home, people's home might be within a care home setting. It might be into residential, and that's fine if you're thinking about options of that as well. A lot of the care homes, you probably aware, are really struggling in terms of staff resource and capacity. And that's something that's a national problem, not just a local problem. And what that means is that staff are absolutely having to do the stuff they have to do, which is personal care, medication, keeping people safe and well. That's the stuff that they have to do. That unfortunately means that some of that other stuff, like the activities, and some of our homes do a cracking job in maintaining activities, but others struggle to be able to do that or do it as well or as much as they would like to do. And already I've had a couple of people say to me, what about, volunteers in care homes? And I'm saying, great idea. How do we look at that? So if there's something, Paula, maybe what you're saying around supporting care homes in a different way, there's something around training and development, there might be something around capacity to do some of the things actually that might help maintain people's activity, prevent frailty, things like that in the care homes that maybe the homes and the existing resource can't do, then that would be something that could be interesting to look at. And absolutely, if I can't come, I think some of you on the call may already have met Adam Durden, Nicole Branvadier, or other members of my team. I'm sure one of us could come out to those sessions and have an open, honest discussion. More than happy to do that.
Perfect. I'll maybe if you could share your email, and then there you go. And then we can invite somebody along and just have that discussion. And because what you said there about just discharge hubs and about system floor meetings and stuff like that, I mean, that's almost perfect, because it's part of the bid is, how are you going to reach these people? Do you know what I mean? How are you going to get to them? And absolutely agree with you about the social isolation stuff and loneliness, because that can impact on somebody's well-being massively.
Yes, it can. Absolutely. Absolutely. And probably more so than the medical side, I think, sometimes, although my medical colleagues might shoot me for saying that. But yeah, I think it is absolutely, the social side so important to get right.
Perfect. Thank you.
Very welcome.
Oh, thanks, Paul. And I guess, of course, from the perspective of the culturally appropriate support, we know that, you know, some of our communities don't access care homes as much. And so it's also a really important aspect of those projects might be, how do you support family carers, or how do you create social groups, or, you know, there's lots of different avenues for this that might look really different in different bits of our borough as well. And we're so open to, like, what does that look like from your perspective? What do you see that's happening in your community that you think you could strengthen, or that this could help you, you know, do more with? So yeah,
that's a really good point, Maddie, because when we do look at our demographic of people accessing care, and particularly in our residential settings, and it doesn't reflect the demographic that we, you know, live and breathe across Hayward, Middleton and Rochdale. So would welcome opportunities, because again, I don't think as a system we get that right. I think that's where the power of working with our community groups, with your knowledge, expertise, relationships, is absolutely critical in doing this. So would absolutely welcome that. And some of those more challenging areas, so working with people with mental health, I think quite a lot of different cultures and individuals feel there's a stigma around that, or caring for people with mental health. Drugs and misuse, substance misuse, things like that as well tend to be areas where we don't always have the support there. And again, they might be issues or complexities locally in different areas that you can pinpoint and maybe come up with some of those solutions too. So it is quite an open fund, and I know that can be difficult when people are bidding for funding, but we've done that deliberately because we want to enable that free thinking, innovation, that whatever you think is an issue locally or across Rochdale, that's where you can tell us, and we can help you shape it with some funding.
Thanks. Any more questions from anyone? Because if not, absolutely, please get in touch. You've got either get in touch directly with your local community development worker, or get in touch development@actiontogether.org.uk, and we can connect with you. We can help you with the bid. We can also then connect you with Hayley's team if that feels like something that would be helpful for you. We're here, whatever you need from us, basically, to make sure we get some really great project ideas in. And so yeah, Laura's very kindly put the links in the chat if you want to go click through to those. And the deadline, Tuesday the 17th of October is deadline. So yeah, I've got about 3.5 weeks. So yeah, hopefully you'll put an application in. And yeah, thank you all for your time for coming, and hopefully see you soon.
I'll see you.
Thank you.
Everyone.
Bye.
Thank you. Laura, should we stop recording?